Hi, everybody. Thanks for joining us. For those of you who don't know me, my name is Peter Llewellyn. I run the services at MedComms So information, resources, services, activities, and so on for people who work across the globe in and around medical communications, medical education, medical publishing, and the associated businesses. We also do a lot for people who are interested in knowing more about our business. Maybe they want to join as a medical writer or account manager or whatever. You can find lots of information at firstmedcommsjob.com. But we do a lot of webinars, we create a lot of video content, and you'll find over at NetworkPharma TV, there's now more than 500 videos on all sorts of topics relevant to MedComms. So go and have a look at all those resources, and obviously if you've got any questions for me, reach out to me. But today I'm absolutely delighted. We've got a panel which spans the world. I think I'm quite excited about this, guys, to be honest. I think we've got a panelist from the US, from the UK, from India, and from Japan. So we have got an international panel, and we know we have an international audience again today. So welcome, everybody. We're going to talk about sponsored supplements as a tool to drive medical content engagement. Hamish, you're going to kick us off. So without further ado, I'm going to hand over to you to introduce and to introduce yourselves and to talk us through, and then we'll have a little bit of a Q&A at the end. So members of the audience, please be ready to send in your questions. Over to you, Hamish.
Yeah, thank you so much, Peter, for having us here today, and thanks to NetworkPharma as well. So yeah, as Peter mentioned, we're here to talk about sponsored supplements as a way to drive content engagement in medical communications. Got a really great panel here today. Starting with myself, I'm Hamish McDougall. I'm the Publishing Solutions Manager at Sage. I've been here for about 5 years now. It's my job to act as a first point of contact for MedComms agencies and pharma publication teams. So you can contact me about any queries related to publications, digital features, plain language summaries, and anything else you can think of as well. But before we start with the presentation, perhaps some of the other panelists could introduce themselves as well, perhaps starting with Avantika.
Thank you, Hamish. Thanks, Peter. Hi, everyone. I'm Avantika, and I work as managing editor at Cactus Communications, specifically their research communication brand. And I've been in this role for more than 2 years now, and I've been at Cactus for more than 5 years. And in my role currently, I work very closely with different stakeholders in the publishing and the medical communication industry, specifically to understand their communication needs and to tailor solutions accordingly. And today I will be talking about the different kinds of digital features that can be offered in addition to publication, and how you can enhance your publications with those.
Great. Krista, perhaps you could go next.
Sure. Good morning, everyone. My name is Krista Storm. I am the principal owner of LBG Health Content Solutions based in the US. And I specialize in strategic publication planning. So I work with various teams, marketing and medical education, primarily in the medical device arena, in taking their content and transforming it into various publications, several supplements and custom opportunities to broaden their dissemination.
Fabulous. And lastly, Nyaka.
Yeah. Hi, everyone. And thanks, Hamish and Peter, and hi, all participants. I've been here with 3 years with Adams as a senior solution manager. I've been in the MedCom business over 20 years, including Adams. And I'm based in Japan, in the agency supporting all the pharmaceutical companies, marketing and medical affairs team, proposing effective evidence-based support for information provision activities tailored to the customer's product life cycles. And today's featured supplements is one of the solutions for those. Thank you.
Fantastic. Thanks, guys. Yeah, so if we could bring up the slides and then we can go through the presentation. Fantastic, thank you. Great, so can we go back one slide? Or is that the first one? Okay. Well, there is a contact information slide, but I'll sort of share that at the end. But please do feel free to reach out to all of us on LinkedIn if you've got any questions as well. But yeah, if you could go on forward one slide and we can talk supplements. So when talking about supplements, we should start off considering use cases and when they're appropriate. And in my personal opinion, they fall into two categories with many use cases in each of those categories. But firstly, providing permanence to short-term content. So things like conference materials, such as posters, abstracts, and presentation abstracts. These are published quite regularly as supplements by industry, societies, and conferences. And these can also extend to a sort of a more hybrid format where you can include manuscripts pertaining to research at the conference, as well as the conference material. Also in the same category, and potentially relating to conferences and events, so writing up symposia into manuscript format or findings from roundtables and guideline discussions. Again, the events can be given a more permanent citable format when you publish them as a supplement. So in the second category is putting together content that fits together thematically. So for example, disease state awareness and surgical approaches, papers that discuss techniques and mechanisms, plain language content such as PLS, standalone PLS, podcasts, infographics and video, educational tools to engage KOLs in specific disease areas or surgical specialties, and pre-launch disease awareness planning. It's worth stating that none of these are mutually exclusive and a supplement can incorporate many of these all in one place. So if we can go on to the next slide, please. We should also consider what the purpose is for industry to go down the supplement publication route. And again, I'm going to split these up into two categories here. So KOL engagement and product lifecycle planning. So when engaging KOLs, journal publishing gives content credibility because of the peer review process and the reputation of the journal itself. So whether it's impact factored or indexed in key places like PubMed. That also adds to discoverability as well. We can also leverage the journal platforms to include multimedia approaches such as videos, infographics, PLS, podcasts, and so on. When considering a product lifecycle, a supplement can act as a great way to bind together medical content around key moments within that lifecycle. So for example, pre-launch, disease awareness planning, or repositioning products post-approval into new indications. So if we can go to the next slide. I think the best way to go forward would be to use a case study here. So here's an example of a supplement we created with Mayako for a roundtable discussion held in Japan regarding tardive dyskinesia. This is pre-launch educational content focused around a particular therapeutic driving disease awareness in the HCP and psychiatric community. The supplement itself consisted of an editorial, 2 reviews published in a psychiatric journal. The journal itself is entirely open access and online only. And then we use the journal platform to incorporate a number of digital elements to enhance the visibility and impact of the content. So in this case, we use both visual and plain language summaries in multiple languages, English and Japanese, to boost the impact of the content. So if we can go on to the next slide. We then set up a dynamic web page for the supplement, which housed all of the published content as well as all of the multimedia content. The visual summaries and the plain language summaries in multiple languages appear near the top to draw people into the supplement, and then having one link to a dynamic page containing all the content makes sharing and improving the reach of all the content far easier and allows for greater discoverability. With the dynamic pages, we have a lot of options too for boosting visibility. For example, we've created banner campaigns posting across our relevant titles to drive attention towards the content. So an example of a campaign we had in 2021 across 3 months for a supplement, we generated 190,000 impressions on the banners and had a click-through rate of 0.04%. We can also use e-blasts as a way to target specialists from a particular area. And in a recent supplement e-blast, we had open rates of nearly 30% and click rates just shy of 11%. So on to the next slide. So while talking about the reach of manuscripts and supplements, it's worth talking about what else we can do to improve not just the views, but people actually engaging with the content. And if you go to the effort of publishing a supplement, then you want to make sure people engage with it as well. And there was this very interesting poster from ISMAP, which described the online habits of doctors and showed that on average, a doctor spends 1 minute and 38 seconds on a publication. So with many publications, they're clearly looking at the introductory materials or the abstract and making decisions quickly as to whether they continue reading it or stop. So this feels like a good time for me to hand over to Avantika, who can talk a little bit about digital features and how they can be used to improve the impact of publications, including supplements.
Thanks, Hamish. Yeah, I think Hamish has already covered the part about how supplements offer a great way to include digital features as part of the publication. I want to go back and talk a little bit about how these features and different alternative content formats can help improve research impact. To begin with, I mean, just to ask the question why these alternative content formats are even needed. I think that when it comes to publishing, whether it's academia or medical publishing, it's well established now that simply publishing technical content is not enough. It's important that there's an increased awareness about how increasing the impact of these publications through different content engagement tools is extremely important. And the fact is that external audiences just want more accessible information. Specifically talking about healthcare practitioners, a large survey that was done by Accenture showed that that several HCPs are eager to, for content that they can very easily pass on directly to their patients, that are easily accessible and digestible. Also considering that HCPs are extremely time poor, they value these bite-sized content formats even more. Several HCPs actually considered plain language summaries to be an extremely useful enhancement, and they also went on to use them to educate their patients, which was extremely useful to them. Just going back to different types of content formats that are available, I think I'll just begin with talking about what infographics are. Essentially, they're extremely engaging visual summaries that convert the most key findings of a research manuscript into a static or an animated format. You can see some samples that I've included here. They cover the most important aspects of a paper in a very engaging way. The most important use case for these infographics is that they're easily shareable on different platforms, different online platforms, especially social media, and can be used to reach a very wide audience that can include clinicians, researchers, media, teachers, and educators as well. Another format that's extremely popular with publications and is encouraged by several medical journals as well is video summaries or video abstracts that are essentially audiovisual summaries that are very useful in simplifying technical key concepts from a published manuscript and engage the audience. They are essentially 1 to 2 minute engaging videos. They could be animated abstracts, or they could just have stock imagery and text on screen, and they could also consist of interviews from interviews by the author, by the authors themselves, and again are a very effective way to distill complex data into engaging content that can be easily shared across different platforms and also embedded directly into the article. And the impact of these formats is evident now, and we've done some case studies that prove this. For American Academy of Neurology, we created several infographics based on their highly technical manuscripts, and we did see an increase in the number of citations, downloads, and an altmetric score for these infographics compared to the ones that did not consist of an infographic. And was also they also observed an increase in readership for their articles that consisted an infographic along with the content. Videos also are extremely useful in increasing engagement. A case study for American Thoracic Society showed that there was a considerable increase in the downloads and the altmetric score of their manuscripts that consisted of a video that was embedded into the manuscript as compared to manuscripts that did not have a video. And another case study that was done for the Journal of Bone and Joint Surgery determined that infographics and videos are again extremely useful in increasing user engagement, number of downloads, and retweets on their Twitter page compared to the manuscripts that did not consist of these digital features. Moving on to another form of alternative content, which is written, which is a written format. We spoke about digital formats for now, and we focused on graphical formats, but there's also the option of including short form content in a written format in the form of plain language summaries. So they're essentially 300 to 600 word short summaries that describe the gist of the study in a simple manner, essentially focusing on the main findings, what is found in the study, why are these findings important. And they're, again, very useful in reaching a wider audience as compared to just the manuscript, such as practitioners, educators, or general public. Case study that we did with PLSs, and there are several other studies that show the same thing compared to just the original abstract. PLSs were perceived as way more comprehensible. They improved understanding. They instigated a lot of positive emotions in their readers, and they were more likely to result in readers accessing the full text article than just just the article that did not consist of a PLS. Another study in PLOS One that showed that publication that included video abstracts and PLSs are way more effective in the audiences being able to understand the content of the manuscript as compared to the traditional forms of content such as scientific and graphical abstracts that are way more technical to understand than other engaging formats such as videos and PLSs. And overall, PLSs in open access articles have also shown to contribute to increased readership. And so they're extremely useful forms of disseminating technical content to a wider audience as well. And I think that's pretty much all about the alternative content formats. And back to you, Peter. We can move to the panel discussion now.
Excellent, thanks guys. That gives us some things to think about. So if we can lose the slides, hopefully, and open this up as a Q&A for the audience. We've already had some questions coming in, we'll handle this. We're winging this a little bit, okay? So I'll back away if you're chatting, and I'll move in if not, sort of thing. And Hamish, if you want to lead it. So between us, we'll work this out, okay? I just wanted, to be honest, from a personal point of view slightly, but can I drag Krista in straight away? I'm just a little bit interested, if you don't mind me putting you on the spot, because you're much more from a medical devices point of view. And I know that when we've talked before, you've said there are differences in the way that maybe some of this content is managed and so on. Could you just give us a flavour, or give me a flavour of how, what sort of differences there are, or how it works in medical devices as opposed to pharma, which is where I suppose I've worked. Does that make sense?
Right. So I think I have worked in pharma years ago, and then I transitioned into the medical device arena. I think the major difference between the two is the technical aspects of the paper themselves. So when you go into the medical device space, we're talking about more approach, more technical, more surgical skill. And I find that those supplements are actually more original content. So we're not taking or transcribing proceedings from an outside event and putting them into a publication. We're actually building the story, if you will, from scratch. And I do think this can translate into the pharma space. I don't know that it's been utilized that way frequently. So what happens is that we work together as a team, whether it's with marketing or medical education, and we define what that story is going to be, and we define what the topics are. And then we create that content to build out the scenario. So the printed supplements have been very successful in the surgical spaces. I think that surgeons do spend time reading. I agree with the panel where we were saying they technically look at the abstracts and get a quick overview to decide if they're going to read further. So having the enhanced options are very valuable because most of these surgeons are actually looking on their phones or their iPads in between cases. So time is definitely a factor. So does that answer your question?
Yeah, no, I mean, and it all is relevant to everybody. Can I go back a step? I mean, again, I've been around a long time, I suppose, in this business, and is this a fair thing to say? I don't know. Each of you might have an opinion on this. You know, sponsored supplements is something that we used to do a long time ago. It was typically something that was a way of getting some conference presentations together in one place, pushing them out. So going back to that slide, I think it was Hamish had a slide where he sort of split, and a bit like what you're talking about, Krista, there's sort of maybe two different aspects here. There's the capturing information presented at a conference, but there's also putting together a medical education package. But a lot of the arguments when I was listening to Hamish talking were very similar to what we might have used a long time ago. And then supplements got a really bad press, and it seemed like nobody talked about sponsoring supplements and stuff like that. And then what you're talking about, although the basic principles are the same, obviously there's so much more you can do than just produce a printed supplement on a shelf now, right? Okay, so there's a number of different things that are going on in there, which I find just quite interesting to think about. Can I just ask, just bluntly, is it a fair thing to say that sponsored supplements just went out of fashion and then they're coming back, but they're coming back in a different format? Am I oversimplifying things, or is there a point in there that may be worth just exploring a little bit? Hamish, can you put me right on this one or not?
No, I think you're sort of bang on the money there. I think they definitely did go out of fashion, and it's sort of the last 3 years or so we've seen a lot of renewed interest in them, and I think it's a lot of newer companies as well that are sort of taking sort of an interest in doing sponsored supplements, and they're seeing the advantages of having these other elements in there. So it's not just publishing some papers or some materials. It's opening up and making it a bit more accessible. And I think, we are starting to see new use cases as well. So it's not just sort of bundling together content. It's now actually sort of, coming up with a theme for that content and trying to actually push it out there. And, I think, there's lots of sort of non-classical sort of publication content that sometimes you might consider as a sponsored supplement as well.
Anyone else got a view on that? I mean, just looking a bit historically and what's happening, how it's changed.
I think from at least what I'm seeing in my with my clients is that historically, there was a theme that you were following. So there was a very specific message that someone was trying to put out, where now I think they're being more proactive and they're trying to address questions that are going on between physicians and kind of answering those questions and taking control of the conversation. So at least in the surgical space, if there's a point counterpoint, if there is some debate, if there's some questions about utility of a certain medical device in a space, that is a good opportunity for them to get ahead of the conversation and to address and talk about the science, the utility science for their specific product in the papers and get that out. And then they can kind of get ahead of the conversation and help everybody understand what's available.
Okay. I mean, it does fascinate me, and listening again to what you're talking about there, Eventka, the proliferation of enhancements and stuff, which we've sort of been talking about for a long time. It's quite interesting that you were able to give quite a few citations there. We've got this evidence and that evidence, and to be frank, it's only relatively recent that we've seen a lot of evidence. There's been a lot of assumptions that these things help, what it seems to me anyway. And it's nice to see there's some real evidence that this is helping a lot. And that's opened up a lot of interest in this sort of activity, yeah?
Yeah, correct. I mean, social media is just like all over the place now, and all kinds of content on there, and it's just become a lot more easier. There's a lot more tools available now to just to analyze how much engagement these digital features are causing among an audience. So there are a lot of studies out there with different kinds of audiences, where whether it's healthcare practitioners or just the academic audience. There's a lot of evidence out there that shows that these alternative formats are extremely important in increasing engagement with the audiences. So yeah.
It was interesting that the slide again, you showed a slide, and the YouTube videos were up at the far end, weren't they? The most engaging sort of thing. I think video is very engaging. I like video, obviously, but there's lots and lots of different ways in which you can slice and dice the data and provide it for different people, and people like this stuff in different sort of ways. Naive question, is it fair to put a naive question? Because a lot of the bad press around supplements a few years ago was all to do with the funding and so on. Just help me understand a little bit what happens in practice in terms of being transparent about funding models and so on. How does it work? Try and paint me a little bit of a picture. Maybe a couple of you, have you got a couple of projects? I don't know. Amy, I'll go to you just to kick us off. But how does it work? And somebody said in there, how's the format? How do you ensure the format's not promotional? Just talk a little bit around that aspect of what we're talking about, yeah?
Absolutely. Well, I think, it's the same with all content, but you have to sort of declare where everything, the involvement of funding and every step of the process. And that's the key to transparency. So, if the project is funded, then it has to be clear that it is funded. If there's been medical writing support, then that needs to be in the declaration. So I think, the ABPI guidelines made that sort of very clear that, the sponsored content is fine, but you just need to declare for transparency where the funding is coming from through each step of the process. But I think maybe, Mayako, you could probably give a good MedComms perspective for this.
I've been listening to all the panelists speaking about this. I've known this supplement things for like over 15 years. And I did make like similar things with clients like 15 years ago when I was in Springer Healthcare with all the 80 Springer journals as well. And at that time, supplement wasn't necessarily always indexed. And it was produced like separately as a single sponsored supplements as a bundle, because at that time it wasn't necessarily open access. And there was no digital features like Avantika just explained. So it was only client, they purchased the supplement issue, like 100 copies or 1,000 copies to distribute individually to the KOLs and to the doctors. So it was part of the journal and indexed in the journal site, but it wasn't indexed in the PubMed. So it was a little bit difficult to sell that services to the clients as well. And as the regulation goes like much more strict, and they have to focus in really purely medicals and neutral contents to be educational, then I think it got it wasn't popular anymore, probably like after a few years. And then now I figured out when I work with Hamish with the Sage journals, now it can be indexed, it's purely published and peer reviewed, and then with the digital features, and that open access things makes it easier to propose the services to the clients as well. And then because in that way, they don't have to just buy the reprints as a print format, but they can distribute the site as an official open journal publication. So in that way, they can expand using that from the medicals to the marketing teams after the product is launched as well. So I think it's quite new again in that terms, and I think digital features made it easier. And for the about the sponsorship, it was acknowledged in the past as well, and but in return they had to distribute by themselves, and it wasn't indexed at that time as a supplement. Sometimes it was called special issue if it was like 50 years anniversary event or something. But now it's indexed, but then we just have to acknowledge clearly it's sponsored by which pharma and all the affiliations, just like the other submitted articles. Is that right, Hamish? Is there any differences?
Yeah, no, that's right. Yeah.
Well, I mean, I think it's interesting listening to talk, and as I say, it's a while since I've been involved directly in this business. But what you're talking about there, America, is it just makes me think back to some of what I did in the old days, sort of thing. And pluses and minuses. There's different things work in different ways, and so on. It used to be quite simple though to say, let's collect that information together, put it into a sponsored supplement, and then that question would come back, is it indexed or not? And often it wasn't, sort of thing, yeah, which may or may not have been a problem in terms of getting the information in a package out to people. So, but it's interesting now, it just sounds, there's so many more options. And what I was going to ask was maybe a stupid question, but I'm allowed to ask stupid questions. What defines, when we say, sponsored supplements, what defines a supplement? Is that a stupid question? I mean, what defines a supplement? Or is that just an easy way of going, a package of information? I'm asking a stupid question. I can't read your faces. Hamish, it looks like you think I'm being a bit stupid.
Yeah, I mean, I'm happy to answer that. So I guess it's, it's something that would appear out of sort of the normal journal issues or volumes. So, it wouldn't just appear as part of the normal journal issues and volumes. It would be a supplement to that. So in that way, it can be sort of a collection of content.
But it doesn't matter what that content, but then it can be any sort of a collection. But you very clearly at your end it's just obvious that, this is a supplement, this is normal journal content, simplifying it. But that's basically what we're saying, isn't it?
Absolutely, but it's not always so clear cut for, say perhaps the users as well, because, say in an open access model where we're publishing continuously, then, the actual articles themselves would appear in the journal stream, and then they would appear on PubMed. So, in the past where we have print journals and, you would get this extra piece, then it was maybe sort of a little bit clearer. Now, I think, it's much more part of sort of normal journal publishing. And that's why it's we have to make it very clear that this is actually sponsored content in the declarations.
Okay. Does that make sense? Anybody else got a comment on that front? No, you don't have to. Someone's asking about, I'm gonna throw this in, see whether this throws a spanner in the works. Someone's asking about ChatGPT, specifically in the context of PLS. So because and PLS can be a whole webinar in itself. Yeah, I've run webinars on PLS, and maybe we can come back to the whole idea of plain language summaries, extending reach, and so on. And the way you described it, I'm completely supportive of. Some people think of it in terms of just patient information. It's not, it's just extending the reach. But I think the way you described it would certainly be aligned with what I think of it as. But the bottom line is it's taking some scientific content and it's re-presenting it in a more general, for a more general audience. So question, does ChatGPT solve a problem that people may have and just say, right now we're going to have gazillions of PLS because it's so easy to use PLS, or what? I think there can be an interesting debate around this, so let's not get bogged down in it. But from your different perspectives, what's your view on the place of ChatGPT, specifically with ChatGPT, but it's AI generally, in terms of representing some information for a wider audience? There's other aspects to this conversation. I'm already feeling like I'm digging myself a hole here, but come on, somebody who's got some experience of this or some views on this. Kirsten, have you got some views on that aspect, or would you like to stay away from AI?
No, it has not come up yet. I know that
Okay.
I will say that I shouldn't say a lot, but several journals now, you actually have to disclose if you used any type of AI service to generate any part of your manuscript. So I think, and that's just the initial submission. So I think that pushes back on the author, but so far that's still very, very new.
Okay, we had a bit of fun in January, didn't we? Because papers were being published with ChatGPT as an author, and then fairly quickly it was established that wasn't quite. Well, it seemed obviously not quite. I mean, it seemed obviously not the not appropriate sort of thing, but that got into policies and so on. But specifically on this question of, can you see people using AI to just produce a lot more PLS and similar sort of content? Have you got any? Ivanka, you look like you're nodding and about to say something, so I'm going to let you have the floor for a moment. Go on.
Right. I think it's come up quite a bit. It's just the hot topic these days, so use of AI tools for writing short form content. And I think the answer is that yes, it will make it much easier for everyone to to have, like, we will see a lot more plain language summaries, and I think that AI tools and the recent, advent of these AI tools and how good they are, I think it's all the more reason for people to start accessing formats such as plain language summaries to disseminate their content. And I think that, and like you said, there could be a whole different discussion on the capabilities of AI. But I think the shorter answer is that yes, it will become much easier to have more plain language summaries with AI.
Extending the conversation out a little bit, do you guys, Hamish, I'm going to come to you as a journal publisher. Are you now addressing the question, do we need to somehow check and police content that's coming in? Again, I'm raising some potentially complicated questions, but are you?
That was true prior to ChatGPT coming out sort of and becoming so big this year as well. I think that's always been a concern, and obviously with paper mills being a thing, increasing technology is always giving them an edge. So it's something that we've always had to be sort of aware of. But I think we also sort of look to the future and sort of think, how can some of these tools used to be enhance accessibility of content as well? So large language models like ChatGPT, or if there are other things like that can allow lots of our content to become more accessible, then that's fantastic. But yeah, obviously we don't want to sort of have entirely sort of AI generated papers, in sort of an unethical way.
Okay. Go on, Miyaka, have you got any comments on the AI side of things?
Yeah, just to comment, I think one of the
sorry. Go on, I was looking at Miyaka, but that's Aventka, isn't it? Go on, keep going. Sorry, I interrupted.
No problem.
You.
I think one of the comments in the chat box talks about how ChatGPT isn't quite there yet, and I agree. I think that it makes it easier to have just like a first draft of the plain language summary, but I think it does require some human intervention, and I do agree that some of these AI tools in the market might not be quite there yet, but I think they will make it much easier to just to have that first draft that can then be reviewed by humans as well.
Okay, I'm fond of saying this is the worst it's going to be, and it's already amazing what it can do. So to some extent, in a year's time, it's going to be fascinating to see what's happening. Miyaka, I'm going to give you an opportunity. Have you got a view on this or not? Because we can move on if not, but I just wanted you to have an opportunity to say something on the AI front.
It's something
you're going to say no
for me, so no.
Okay, you're going to back Okay. I'm having long discussions with people about AI. I'm thoroughly enjoying it at the moment. I don't tend to know what the answers are, but it's fascinating what some people are doing. So health warning, something like ChatGPT does cause problems and does hallucinate and all the rest of it. I know that, but it can also do some amazing things. And I think the direction of travel is absolutely fascinating. Let's go off in a different direction. And audience members, please do put some questions in here if you want to. Otherwise, we're going to be left to our own devices here. What about sort of international globalization stuff, translation issues, compliance issues, regulations around the world? Who can talk a bit about that? Miyaka, I'm going to put you on the spot again. When you're planning projects like this, just to give us a sense of the practicalities at your end in terms of dealing with that. Let's take translation issues as a point. How much do you encourage translation into local language versions and so on? And what are the practical issues of that? You see what I'm getting at?
Are you talking to me?
Oh, yeah, sorry. Yeah.
Okay.
That's sort of what I was hoping. Yeah.
Like back in 10 years ago, I used to always propose a bundle as a supplement plus the translation reprints afterwards, because the client always wants to distribute something, their output, because that time it wasn't open access. But since open access is the standard and client wants to distribute the information as soon as possible, then there's no reprints requirements anymore. So in return, they don't even need a full translation of the article itself, which we used to do like back in 10 years ago. So instead, that infographics or the plain language summary thing, that all helps it's quick to easily understandable, and then if it's translated, it's short and it's in public, they can share it. So I propose that to the clients for the wider distribution, because it's targeted for, they were expecting their products to launch in Japan. So I think that makes clients happy. It's quicker, easier, and it's more reasonable rather than translating the full context as well. So.
Okay. Anyone got a view on that or comment on that? We've got another question coming from John. Again, it's a process type. It was a process type question. So, I mean, you know, I get the fact that as an author, if I want to submit a paper or something, I might talk to you. There's a process. I might talk to you and say, is this a relevant article for your journal? And there's that sort of discussion that goes on. When it comes to supplements, tell us a little bit about the process involved in that. You know, do you go out and look for supplements on topics? Do people come to you with the idea? And how does that work then in terms of vetting the idea, vetting the content, peer review, and so on? You can see what John's getting at there. Hamish, you're nodding your head. Do you want to take that one?
Yeah, absolutely. So the vetting process starts, you know, right at the beginning. So as soon as the contract begins, we would ask people to put together a proposal, listing kind of the topics, and also, you know, what the content would be. And then we would have to run that by the editor, who would decide, firstly, if it's in scope, and secondly, if it's actually sort of, you know, if there's some value to the content as well. And then sort of beyond that, then we have the peer review process as well. So, you know, there is definitely sort of an extra step of vetting, but I wouldn't say it's any different to sort of doing a standard pre-submission inquiry for sort of a manuscript article.
And maybe this is a question that then applies to everything you deal with, but thinking about all those infographics and videos and all those multiple ways in which you deal with content now, all of that's peer reviewed, some of it's peer reviewed. What sort of decisions are being taken there?
Everything's peer reviewed, yeah, especially with regards, yeah, all of the supplementary materials such as the video abstracts, PLS, infographics would have to be peer reviewed. Yeah, and you know, especially when it comes to sponsored content, it's really key that it is peer reviewed. And I think from a compliance perspective, pharmaceutical companies really appreciate that, because then they don't sort of see any issues from their end. Once something is peer reviewed, then it's sort of not necessarily seen as sort of marketing content, it's seen as educational content.
Okay, that makes sense to me. We've got we're probably slightly over time, but let's just finish off on this question, because I must admit, again, it's something I'm quite keen on. And I was listening to what you said, Hamish. I think it was Hamish was talking about it in terms of measuring and metrics and stuff like that. Can we just spend a couple of minutes maybe getting some different views on this? Because some of it's quite easy to go, oh, we've got this sort of open rate on an email, or this sort of a click-through rate, but you then start to talk about the actual engagement with the content. Can you, and maybe there's a couple of you that could give different views on how we actually work out whether publishing this thing has been any flipping use at all? You know, has not just has anyone looked at it, but someone somehow properly engaged with it and done something as a result of that. How far can we go with that? Who can talk to me a bit about that? Come on, I'm looking for Krista. Go on. I'm going to put you on the spot for a moment there. How do you work out whether people are actually engaging with the content? You're going to bounce it back, aren't you? Oh no.
Sorry, I was reading the chat. Engaging.
Oh, right.
Engaging the readers to actually.
How do you measure whether you've got a benefit, whether it's actually happening or not? Not that someone's just had a look or someone's opened your email. How are you measuring or trying to measure whether this has an impact and a real result in real life? You see what I mean?
I think it's probably different in my space, because it's actually. We do a lot of print, and metrics are very difficult with print collateral, because obviously it's mailed out. But I think a measurement from the client side is based on how many cases they are receiving based off the topic of the issue. So it's always linked directly back to the surgical case in my situations. So they are actively able to measure the field presence and what they're getting in response to that content.
Okay. I suppose my question was aimed at the digital space. Yeah, so sorry. That was a fair point. Evanka, have you got a point on that in terms of how you're measuring? Because you don't just measure clicks, do you? You must be going further than that.
Yeah, I think user engagement is very easily determined by the number of downloads on a particular manuscript. We also measure the altmetric score, which talks about how, how other platforms that are basically, it could be media, it could be any online platforms out there are talking about or citing the manuscript. All of these are in addition to the, traditional ways of measuring impact, such as number of citations. The altmetric score is extremely popular these days to measure citations in non-traditional outlets or platforms, including social media.
Okay, should we wrap up there, guys? I'm not sure if anybody got anything else to add into this, or should we are slightly over time, to be honest, so should we draw the line there? I'm going to say thank you very much. There's lots of food for thought in there. And I know I can speak for you and say that you're happy to hear from people. LinkedIn is an easy way of contacting you. So please, anybody watching this, please reach out and talk to each other and follow up with questions and so on. Those of you watching today, we're here for another few minutes, so don't run away. And there are a couple of little questions in there we can pick up on. But for today, I'm going to say thank you. I'm